So it has been an exciting time transforming and growing with HealthTalk AI. My name is Brandy Wolf, and I do clinical informatics here at Ward Memorial Hospital here in West Texas. One of the challenges of working in a rural community is you never have enough people. So you have several staff members that wear multiple hats and try to juggle those daily challenges. And so when we met Health Talk AI last year, we were really intrigued because they can offer a lot of things that would alleviate some of these workloads off of our staff and allow us to get back to that patient bedside care. What jumped out to us when we met Jared at Torch last year, first thing is they were able to work with our EHR, right? Because that's always a challenge of doing those integrations. And so we were super excited to hear that. And then just the kindness that we were first greeted with, and then their dedication. My goodness, that team is super dedicated to us. If we ever need anything, they're quick to respond. It has been a wonderful experience. We plan to utilize HealthTalk AI to reach out to our patients and just say, hey, it's time for your yearly checkup, or hey, you haven't had a mammogram this year, let's get you in. And so that our patients realize we are watching your health. We want you to be healthier. And this is going to help us maintain our patients' health and give them the better outcome. HealthTalk AI was very proactive, making sure we touched base weekly, identify any challenges, provided any assistance. If we were having this challenge with our EHR, let's brainstorm this. How can we get over this hurdle? And was always willing to help. They offer so many different services. It was identifying, okay, once we get integrated, here's the first thing we want to do. We want to roll out that patient reminder, right? Just help automate that, remind the patient. If the patient can't make it, they're able to communicate back with us. So it has been an exciting time transforming and growing with HealthTalk AI. We plan on using this hospital-wide because they offer so many different services. We're going to start one department at a time. The next department in mind is we're going to be looking at our respiratory program. They offer so many different services where HealthTalk AI is going to help them. They're a very small department. They only have a few people. So this will allow them more time with their patients, with HealthTalk AI doing all the computer work for us in the background. So we're looking forward to getting this implemented in all of our departments of the hospital. The advice I would give them is select HealthTalk AI. One thing we've enjoyed is if we come up with something such as we want to do a new outreach program, their team is engaged. They are there. They are brainstorming with us. How do we get this rolled out? Let's practice this. Hey, what if we try doing this task? And what I'm saying is they are fantastic at brainstorming and helping us to come up with what we're wanting, and then even providing suggestions. This has been a great team to work with, and I'm so glad this is who we went with. We are excited to use HealthTalk AI for our patient reminders because that's one less thing our office staff has to do, right? They don't have to spend time away from helping patients that are here in our waiting room. And this is going to be an automated system where they can, yes, I'm going to make my appointment. And then our next goal is HealthTalk AI is going to say, yes, all right, before you get here, let's get your paperwork filled out, right? Because now you're not going to have to wait in our waiting room an extra 10, 15 minutes while you're doing all this paperwork before we get you back. And so we see how this is going to help our staff, but more importantly, this is going to help our patients as well. And that is why we're so excited. I see a long-term partnership with them.